Switching now to our third Midday Forum, and joining us is Dr. Gina Mentzer with the Nebraska Heart Institute. And today we're going to be talking about some links between heart health and maybe even some emotional health and issues like that. Tell us a little bit about some new studies that are taking place and what you guys found out.
It's very exciting in the field of cardiology. Mental health is intimate and intricately associated with mental health. So if you treat one, you treat the other. The whole body needs oxygen, blood flow to feel good. And so your brain releases these chemicals that it produces, and without those supplements and without the heart pumping it to it,
Sure.
it just can't produce them.
So how do you kind of treat both at the same time?
So, well, there's lots of different things. One is a molecular basis. So we do a lot of medications called neurohormonal regulation. Very complex term.
Exactly.
However, by getting good blood pressure and oxygen to the body, to all parts of the body can produce those substances and deal with stress better. One thing we look at is when somebody is having a lot of stress, you get the fight or flight response. Sure. And so your body produces a lot of these stress hormones that gets you running. Maybe makes your heart beat faster, makes you think faster. But if that process is going on for days, weeks, and months, your body runs out of those release responses.
Sure.
So and that's the chemicals, the feel-good chemicals that make you feel good in order to keep going every day, have the drive to do what you do, take your medications. So it depletes the storage of the feel-good chemicals.
Sure. So the next question, what can people do to improve mental health via the heart?
So that would be looking at the American Heart Association's Simple 7. That's as simple as I can keep it. Know your numbers, your cholesterol, your blood pressure, exercise, eat healthy, know your risk factors, and really good prevention. So working with your primary care doctors and then getting a good cardiovascular evaluation.
It is kind of interesting how the whole body kind of works together. When you focus on one area, you're going to benefit several other areas, so good to know.
We've found in people who've had cardiac surgery, strokes, or heart failure, about 60% of people have depression.
Wow.
Or some sort of mood disorder. Which, is that the primary problem or secondary? We believe it's a secondary. So if we improve the heart, that will improve. But we also found with our studies that that mood gets in the way of you taking your medications or doing the Simple
Sure.
7. So we also have to treat the mood because they're so intertwined.
There you go. Well, good to know and interesting information. We appreciate you joining us.
Thank you. It's very exciting.
And we will be right back with a recipe from the test kitchen. You're watching Channel 8 Eyewitness News Midday.